I am Jonathan Cushing. iACT to fight corruption. So currently we see there's great demand for vaccines from governments, from nation states, and there's a kind of global rush to immunize populations in countries around the world so that we can end this crisis. Various integrity risks associated with this. I think the kind of major one, certainly from Transparency International side that we've seen over the last kind of 6 months, is the opacity in the contracts between governments and vaccine manufacturers. And we would like to see much greater transparency there so that we can understand what governments are signing up to. Transparency is built into those grants, those loan agreements, to effectively put some kind of top-down pressure, although I don't like that phrase, onto recipients. We will grant the funds, but we need to have the integrity measures built into this. And in many ways, that can serve as a bit of a kind of catalyst for governments as well and recipients to say, okay, building it into this loan from ADB or this grant, why not just build it into the system? I see a kind of key role there for IFIs as well, to work with both civil society and governments. From our perspective, we'd like to see governments, ministries of health, working with communities on the ground and engaging with them. But you can also look at using kind of community feedback groups to the district or the health authorities where communities can actually engage and having that consultative process. And I think in many ways, this actually presents an opportunity as we come out of COVID as well to kind of rethink how do we build in accountability into the health system. And also encourage is much greater transparency in the sharing of information around the rollouts as to who gets vaccines when, how that rollout plan is done, to ensure that it's equitable, that those who need it the most get it. And that typically is, say, healthcare workers and those with existing conditions that place them at higher risk from COVID.